Hello, everybody. Let's talk about data, AI, and healthcare. So AI is on the lips of pretty much everybody nowadays. For example, in healthcare, AI is being used or tailored to problems such as precision medicine, health monitoring, identifying patients that may belong to a risk group, or finding optimal care paths, or clinical trial matching, and so forth. The landscape of potential for AI is huge, so I could go on and enumerate many different areas where AI is being applied at the moment. However, in order to actually work with AI in healthcare or any data-driven application, there are some obstacles in the way that need to be overcome. For example, data is normally stored in systems scattered in different places. Data formats are different from system to system, or the actual form of the data is not directly understood by the machines which crunch the data, but instead is meant for human digestion. For example, patient journals, which is a very common data format. And thirdly, the management use of the data is highly regulated. So in order to be GDPR compliant and so forth, you need to pay attention to the regulation and the terms and adhere to them. So all in all, this gets us to the data size dilemma, which you see all over the place, and it's present very well even in healthcare, that because of these obstacles, a lot of the time, data analysts' time does not go into analyzing the data, but actually preparing the data. So it's said that roughly 80% of the time is actually spent on preparing the data. For example, structuring the patient journals, joining database tables, encrypting, pseudonymizing, anonymizing data, and so forth. So it tells us something about the feasibility of starting quickly doing something. There are actually some blockers in the way. But before going forward, let's take a step back, thinking of an organization who wants to apply AI on something. For example, things mentioned before. That sometimes the mental picture, the organization, let's call it the status quo organization, may be like this mental canyon that's in between the land promised by AI, or at least by the data scientists. And given this situation, it's hard to find the right way to move forward in order to reach this promised land. There are many ways how to do it, but usually people coin in the term of data platform. So what it actually is, it's meant for helping to move forward towards getting actual value from this AI-driven application. We might be talking about data platforms that handle data security, integration, provide compute capacity, data cataloging for data lakes, AI modeling environments, and so forth, that make the data science life easier. And actually, platforms like this then mitigate the effect of data preparation. They take care of the mundane pre-processing tasks that the data scientists usually perform. And this is not specific to healthcare. This is present pretty much everywhere. But the other thing is, so it's not just about having the technical capability of extracting insight from data, using, for example, a data platform and the applications on top of them. It's also about how to use the data. How do you act or react based on the new data-driven insight that you get from your systems? How well the organization is prepared for this? Is there a plan for it? So some kind of change management is also really important besides this so-called data vision or data strategy that goes into the reorganizing the IT systems, for example. So how to act on this new data so as to bring value. If you don't act on new data, for example, get a forecast for service usage, how do you act on that information? Is there actual people and processes in place that take care of that? I have a couple cases prepared prepared for you. So this now goes into the actual work that we are doing in Tieto, in the data-driven business unit. We ran a pilot study about a year ago with the city of Espoo, and the idea was to collect data from these different systems: welfare system, healthcare system, early education system, citizen registry, and so forth, and make advanced machine learning pipeline that would provide population views, segmentation on the population or citizens of Espoo, have status and forecasts of service usage now and in the future, so that the city personnel would have better insight on the service usage and act accordingly. A bit more about the numbers. So we are talking about quite big project. We collected data from over 10 years of time, spanning from 2002 to 2016. We're talking about over 500 million rows of data, and it covered all of Espoo pretty much. And one thing you saw in the news perhaps was that we did focus on this child welfare service risk prediction, where these certain risk factors were brought up as a result of the analysis. But it also did all kinds of other things as well. For example, interactive dashboarding. How do you make sense of all the data? So first and foremost, we did a lot of integration work to bring these systems together for the first time, perhaps ever. So the clear idea that comes into mind immediately afterwards is that, hey, we want to see the data. What is it telling us? So now we get into the population view. What kind of demographic factors have we collected? What kind of clinical, medical status and so forth, which would then help identify different groups in the data that would better guide the healthcare service providers in their daily work. That was one focus. But also have these machine learning algorithms to provide data-driven insight. For example, can we automatically detect different subpopulations in the data? For example, what is the so-called normal subpopulation? Are there some disease groups present? Do they emerge naturally from the data that was given to the machine without a clinician actually providing the criterion for these segments? And the answer was yes. We could provide insight into what kind of clinical groups the citizens of Espoo fall into. And this project or pilot was recognized internationally. For example, Espoo was named the most intelligent community in the world. So coincidentally, we were at the same time running this pilot. So perhaps we contributed to the nomination. But also this was recognized widely in the news as well, perhaps because of the unique nature of this study we did. So we showed the potential of data-driven population level study, that what it might have to societies. We can better design services for the people which is best for them. And another case I'm going to show you is LähiTapiola. LähiTapiola is an insurance company, and about a year ago they launched this new digital service called Terveyshelppi, which provides chat, phone call, and other digital services to perhaps speed up the service for people for whom the digital services is sufficient, and in a way guiding some of the traffic from these traditional service channels to these faster digital channels. So the key question they wanted to answer in this study was that when does Terveyshelppi provide better outcome than traditional service channels? So we had a challenge to actually run an impact analysis on their data that they were starting, or they had just started to collect, but LähiTapiola was missing the tools to actually do this kind of impact analytics, which requires that you extract data from the receipts, how much different services cost, what kind of background information was there, what were the different service channel options that were chosen, and so forth. So having essentially similar kind of approach, so we were leveraging the same kind of tools that we have been developing in Tieto for analyzing large amounts of data. Similar kind of interactive dashboard was used, but this time for providing custom segmentation so that the clinicians, the experts in the domain, can identify the, let's say, diagnosis groups that have a peculiar cost structure, that show clearly that in some cases, or in most cases, the digital channel is actually something worth pursuing, and that provides then insight to the management level, that what kind of advertisement, for example, should be targeted to different groups of people depending on their background, for example, demographic background or the claim metadata and so forth. So all in all, these two cases actually were really showing that even though a lot of the hype is about these very advanced AI technologies, but at the same time there's a lot to be gained from these maybe more traditional or lower level analytics that includes integration of these data sources together, because as said, one of the pressing challenges with healthcare data analysis is the abundance of data silos. So there is not many integration channels, and this is what we were tackling first. To conclude, so adopting a data vision and data strategy is crucial for digital transformation. It sort of helps to get over the mental canyon that I showed before. But also having this machinery or process to do proof of concepts or quick trials helps to quantify the potential or some of the potential benefits of new data-driven services. So it's not that everything should be prepared beforehand, like building the data platform and have everything served before you can start running trials. It should actually happen in parallel so that you get idea of these proof of concepts, that what might bring value to the company, while at the same time having this long-term data strategy and vision that paves the way for long-term sustained value influx from these data-driven services. And data science is normally bottlenecked by data preparation, but I'm repeating myself, this data platform helps overcome some of it. And we are still, even though whatever is told in the news, I think that the reality is we are in the early days of digital transformation, so there's a lot to be gained. And it's not just technological advancement that needs to take place, it's also organizational. So we need both the data strategy and change management to reorganize the organizations. And knowing where all this is going to eventually lead, maybe in 10 or 20 years, I think it's not as important as taking the first step, if you haven't already taken. That's it. Thank you.